morning, I'm Dr. Salma Aziz, and today we're going to talk about flat feet. Flat feet is one of the most common deformities or diagnoses that present to our office, and it is one of the most common foot deformities that patients are walking with without realizing that they have something that could potentially cause them problems in the future. So let's get talking about what flat feet are and how they affect us long term. We're going to talk a little bit about what constitutes flat feet. The first thing to talk about is what is the cause of it. The most common cause of flat feet happens to be genetic, and when I'm talking about flat feet, we're talking about that which refers to the height or stability of the arch of the foot, the midline of the body and then the arch of the foot. So I said that the most common cause is genetic, but we do also realize that such factors as arthritis, as trauma, and also micro-trauma over a period of time where the patient is subjecting their foot to excess pressure and micro-trauma for a very long period of time can be the cause of flat-footedness. One of the most common ways that patients refer to flat feet is, well, I have collapsed arches. That's what they usually present with because they've noticed something different in their feet or a change in their foot. Now that we know what the common causes are, let's focus a little about what happens when we lose this arch and why is it so important as far as making sure that we don't allow this to go untreated for a long period of time, as this serves to be the cause of many of the foot deformities that most of our patients present with. All right, so a quick little review of what happens. As I said earlier, this is a model of our foot, and we're looking at the height, if you will, as far as the height of the arch of the foot with regards to the weight-bearing surface is concerned. When we're born, we're either born with an arch or without one. And if we have an arch that is significantly lower than what is normal as far as the anatomic alignment of the foot and ankle is concerned, then that is what we use as far as diagnosing the patient with a flat foot. So essentially, instead of having a foot with an arch that has a height like this, what happens is the patient's foot, ankle, and the entire complex collapse, and they do a motion like this where the arch height is lost basically. This then causes a number of other foot deformities, both in the forefoot or the front of the foot as well as the back of the foot. So it is this movement that we have to control and support in order to prevent all those other deformities that are occurring. This is the main reason that we need to make sure that we diagnose and treat flat-footedness at an early age, so to prevent all these other deformities from coming about later on. Okay, so we've now diagnosed our flat feet. Now, how do we treat this? If we are successful in detecting flat-footedness early on, then what we are able to do is treat the patient such that they can have a great prognosis with the treatment that we're initiating, and ultimately what we're doing is hopefully preventing that patient from having multiple foot problems down in their future, as well as many times prevent patients from having to undergo painful surgeries that they would have to endure if they did not treat their flat-footedness. Okay. The most common problems associated with flat-footedness that does not get treated are some of the more other common foot problems that we see in our office, such things as bunions, hammer toes, plantar fasciitis, also known as heel spur syndrome. These are our hammer toes. These are all factors that are ultimately, if we look at the root cause of them, they're factors that are related to flat-footedness. Now, treatments. Well, if we categorize the treatments of flat-footedness, it's basically conservative and surgical. The key, again, to determining the type of treatment for this is early detection. If we're able to detect flat-footedness early on, we are then able to basically treat patients in a manner where we maintain the stability of their foot and ankle and ultimately prevent all those other things. Conservative treatment, the key factor in conservative treatment happens to be controlling custom orthotics. So we utilize this to maintain the stable position of the foot and ankle that is lost as a result of the foot and ankle collapsing. And by doing that, we are then allowing the foot to be a more neutral, more functional, basically, machine, and as a result, you're preventing all these other factors from coming about. If we catch a patient much later in life and they have had significant other problems that are a result of the flat-footedness, then that patient unfortunately oftentimes becomes a surgical candidate for flat-footedness. And the surgeries for flat feet vary in that depending on the advancement of your flat-footedness, that surgical intervention also varies. In other words, if we catch a surgical flat foot early on, we're able to do a lot of soft tissue treatments for it, surgical treatments for it, which don't require as long of a recovery for the patient. However, if a patient has ignored the symptoms of their flat-footedness for a long period of time and they present to our office with a more rigid flat-footedness, then the surgical correction for that becomes more bony in nature, requiring a much longer period of recovery. So as far as flat-footedness is concerned, again, the big thing to remember is it is well worth it for you to get a early diagnosis so that you can get the benefits of the early treatments that are available for flat-footedness. Thank you for watching today, and hopefully today's educational message was of use to you guys. Have a great day.